Hello, everyone. My name's Trey Cloud. I'm a third year here at UGA. I'm pre-vet of interest in large animals, more specifically horses. So today I'm going to be talking about bacterial diseases in horses. And the first thing that I want to talk about is what are bacterial diseases? The International Encyclopedia of Health's definition is bacterial disease can occur at any body site and can be caused by the organism itself or by the body's response to its presence. Bacteria are transmitted to humans through air, water, food, or living vectors. The principal modes of transmission of bacterial infection are contact, airborne, droplet, vectors, and vehicular. And then there are a lot of equine bacterial diseases, but the ones that I'm going to talk about today are some really common ones. There are strangles, equine influenza virus, and vascular stomatitis. So the first one we're going to talk about is strangles. It's the most common, and the causative agent for strangles is Streptococcus equi, or it's also known as SEE. And some background information is that strangles is a highly contagious, rapid spread microorganism. Signs usually appear after a 3 to 8 day incubation period, and some of the signs can include things like fever, anorexia, depression, and nasal discharge. Pharyngitis and lymphadenopathy develop in most horses, which causes a reluctance to eat, drink, and sometimes upper airway obstruction. Metastatic abscessation, also commonly referred to as bastard strangles, occurs when the infection spreads to the lymph nodes or tissues distant from the lymph nodes of the head and neck. And then this also often causes death. So the most severe form would be the bastard strangles, or it's also known as metastatic abscessation. Some prevention uh, keys would be things like limiting moving horses from place to place. So trying to limit the movement of your horse from different places helps prevent the chances of your horse getting strangles. And then if one horse becomes affected, you want to immediately quarantine that horse away from the herd. And then if you're going to add a horse to your herd, you should quarantine that horse approximately 14 days before you introduce it to the herd. So you should, like if you were to get a new horse, quarantine it by itself for about 2 weeks, and then you can put it with your herd. Vaccinations, another way uh, to try to prevent strangles. And then treatments for strangles. The main one that I saw was endoscopic guttural pouch lavage. And what that is basically they're going in and they're draining the guttural pouch and kind of cleaning it up, which is where the strangles kind of accumulates and infects. So then the second one we're going to talk about is equine influenza virus. It has two known subtypes, H3N8 and H7N7. The H7N7 one hasn't been around for about 30 years, so it is thought to be extinct. And then the H3N8 one is the one that's in circulation now. And equine influenza virus, also known as EIV, is a common respiratory pathogen in horses, and it's a type A influenza. It's acute and highly contagious. And then some signs of EIV include development of pyrexia, coughing, and nasal discharge. It's an upper respiratory disease, and the severity really depends on the immune system of the infected horse. A better immune system, the less it's going to affect them. And it's normally not life-threatening unless it's present in a very young foal, and that's just because their immune system hasn't really gotten time to build up. So it can be life-threatening to foals, but usually not life-threatening to horses that are a little bit older. There are two EIV vaccines currently marketed in the US, and that's inactivated and a modified live vaccine. However, there are other vaccines licensed for use in other parts of the world, and those include a recombinant virus vector vaccine and a subunit vaccine. And then the last widespread outbreak of EIV was in 2003, and it was among vaccinated racehorses in the UK. And then some prevention tactics, of course, the vaccinations that we talked about. Quarantining horses, it's always going to be a good prevention. And then isolate horses that could have contacted any other quarantine horses. So if you see a horse that's showing clinical signs or has it, you want to isolate other horses that could have come in contact with them or come in contact with things that the quarantine horses might have also come in contact with. And then treatment is really symptom based. It's going to be depending on what symptoms you have, but good stall rest and adequate nutrition is a really good place to start. And it's also recommended for rehabilitation that the horse gets 1 week of rest per each day of fever. And from what I saw researching this, that's going to be about 30 to 60 days of rest for your horse. And then vascular stomatitis, its cause of agent is vascular viruses. And there's two main strands of vascular stomatitis, a New Jersey virus and a Indiana virus. It is confined to the Americas. So it's in the United States, Mexico, most of Central America, and some of the northern parts of South America. And some clinical signs include vascular or blister-like lesions, and those can occur on the oral mucosa, the tongue, teats, lips, muzzle, and coronary bands. And then the lesions that are on or around the mouth usually cause hypersalivation, but the lesions on coronary bands can sometimes cause lameness. And then transmission usually occurs from insects, biting insects that are going from horse to horse, but it can also occur from virus containing liquid or fluids. So any fluids from the lesion or saliva, things like that. And then some prevention, of course, quarantining, insect control. So any products that can control the insects uh, from being like biting on your horses and stuff like that would be a good prevention. And then sanitation of communal and water and feed troughs. So any place that your herd maybe is sharing water or eating out of the same trough, something like that, make sure that you sanitize that really good would be another good way to prevent vascular stomatitis. And then some treatments, make water and soft food available. Sometimes intravenous fluids can help. I saw some things where antiseptic mouthwash can help with the tongue and oral mucosa, that area lesions. And then if you're gonna have the coronary band lesions, then you're gonna have to do some lameness management. So, lameness can be a lot of things, but some management of that if you have the coronary band lesions. And then I found this really interesting was the vascular stomatitis outbreaks in recent history in the United States. There was one in 2019 and one in 2020. The 2019 outbreak had a total of 1,144 affected premises, and that was in 11 counties over 8 states. The states being Texas, New Mexico, Colorado, Wyoming, Oklahoma, Kansas, Utah, and Nebraska. It actually was the largest U.S. outbreak in at least the past 40 years of recorded history. And then the 2020 outbreak had a total of 326 affected premises in 70 counties over 8 states, with new counties being, or new states, being Kansas, or Arkansas, and Missouri. And then you can kind of see the affected areas and the counties in which the vesicular stomatitis was found and the severity of it. And then these were my references. Um, and yeah, I hope you guys enjoy learning a little bit about equine bacterial diseases.